I want to welcome everyone to our second episode of the live video that we're doing every Thursday at 12:30 from the office. I'm Dr. Armen Vartany, and last week we did our first episode where I spoke about a case that I had, which was particularly interesting and challenging, which was a rhinoplasty case, and I talked a little about the different types of rhinoplasty and that procedure in general. And today we've invited our office staff to sort of ask the questions that most patients ask them when they come in for consultation or when they call. And for the viewers, I just wanted to mention again that you can ask questions. You can post your questions in the comment section. And if you're not watching it live, you can still post questions. And any comments you have, we'd appreciate them, and we would answer the questions next week. So I'll introduce Danae.
Wait, and we actually have had a lot of questions. We have a lot of questions in general from our patients, but we've had a couple come up since our introduction to Live with Dr. Vartany last week. So, one of the biggest questions that I get is, what is the percentage of rhinoplasties that you do closed versus open? So what is the percentage that you do closed? Because it seems like a lot.
Okay, that's it. So the last time we talked about the closed versus open rhinoplasty, which for people who may not know it, closed is when the incisions are on the inside of the nose. There are no visible incisions. And open is when the incision is, there's, as well as the internal incision, there's a little incision at the bottom. And the technique is to open the, to flip the skin and soft tissue open, and to do the procedure by having direct
When you have
approach.
direct access when it's
right.
open. So,
Yeah.
But you don't seem to do that many of
So
those.
I don't do only closed, or I don't. There are surgeons who do only closed. There are surgeons who do only open. I believe that it depends on the nose. Depends depends what the what I need to do. So if I can do everything that I need to do with the closed technique, I do it closed. What percentage is closed? Probably 90%. I do it closed, closed or intranasal. If a case is particularly difficult, if I have to do a lot on the tip, or like the case I mentioned last week, if it's extremely crooked, broken nose, then I do it open. Now you may ask every question, then why don't you do all of them open?
I mean, you have all this, access to see it so clearly, so plainly. I mean, why not do it open? Is it?
The disadvantage of doing it open is that you, in order to have that access, in order to to expose and dissect all the structures, you're causing a little more scarring, a little more swelling, longer swelling, as well as the incision that is not usually visible. But if I can do without it, I do without it.
So the fact that you do 90% of them closed is thumbs up.
It's good. Yes.
It's a good thing.
And we have another question to know, how long does the surgery take?
So the rhinoplasty surgery usually takes about 2.5 hours. And that includes the, most people usually have a septal deviation. And so that includes the septum and the rhinoplasty portion. And to go back to the open and the closed, closed takes a little longer. So usually if it's open takes a little longer. So if it's open, usually takes me 3 hours. So 2.5 to 3 hours.
Well, that's amazing. I would think it would be the opposite, because you are working in such a tiny space and doing so much, by feel, by just knowledge. I would think that would take longer. That's amazing to me.
No,
dissection.
Just the dissection takes time.
Wow.
To get to. where you want to get to.
A lot of patients ask if it's better to book in the winter and the summer, and I know the answer to this, but we get asked it every time during a consultation, just about every time.
So I tell people that it depends on your schedule. It really doesn't matter if it's in the summer or the winter. You need to take, as you know, about 10 days off. So if that's more convenient to your lifestyle to do it in the summer, then summer is the time for you to do it. If it's more convenient to take time off during winter break, then that's it. Because,
in terms of healing, is there any difference for the seasons?
No, not really. I mean, with the exception that after rhinoplasty, you can't go to the pool or go to the beach for about 3 or 4 weeks. So if you're
More about your schedule,
yeah, so if you're a beach person, or
Yeah.
then
Book year round then.
Yeah.
Oh, good.
yeah, then winter's
I get asked that question all the time, and I think that patients are wondering if it's hot, is that going to have their swelling stay around longer, or is it better when it's colder weather? Because we tell patients not to get overheated.
to avoid, yeah.
But I mean, I'm in air conditioning all the time,
Yeah.
so it doesn't
No,
affect
that's
me.
true. Yeah.
Yeah.
The heat makes the swelling more. So we ask them to avoid
Getting
heat. But
suntanning.
like you said, it's with air conditioning that really is taken
And
out
if you
of
don't
the
have air conditioning, move.
Yeah. And actually, a question that I get asked a lot, and I actually am really curious, is how many do you think you do a year?
Well, rhinoplasties, I do somewhere between 150 to 200 a year. So that's the majority of my practice.
Yeah.
I've been probably doing that for the past 10 or 15 years.
That's what makes him the expert.
Oh.
Yeah.
I guess you do something enough, you're going to know how to do it, right?
So, what else? Any
I
other
had
questions?
One other question
Yeah.
was, you get a lot of online reviews. Can I believe those reviews?
That's actually a very good question because it's for someone who's looking to is trying to decide who to go to for rhinoplasty. The internet is full of glowing reviews for everyone pretty much, and it's hard to know which reviews are genuine, are true, which ones are not. And usually I, like any other review site, that the review site I think is important, to know if they're if there's a reliable review site or not. And if someone has only 5-star reviews, I usually take to think twice about believing all those.
The nice thing about Yelp is that you can't decide which reviews you want to show. You
Right.
don't have, it's done by their algorithm, and you don't have any control over it. So when somebody
that's
puts
true.
a review up, I mean, it is authentic.
Right.
authentic.
You can't take it down, or you can't pay
No,
you
pay
can't.
to yeah. But if the Yelp, the reviews that are on someone's their own website, that's different. That you can take them off, or you can pick and choose which ones you want on, or you want to take off.
Yeah, that's true.
Yeah, but also I think if you're trying to decide, if someone's trying to decide how to pick a surgeon to go to, I think one of the biggest ways to decide is if that person does a lot of that operation, especially rhinoplasty, where I talked about last week. It takes a long time. You have to do a lot of it to be really good at it. You can judge that by how many before and after pictures they have of that particular procedure, and you could also call the office and say, what does he do the most? What is his specialty? Or how many, or like Amanda asked, how many of these procedures does he do each year? You can ask the staff that. You can ask the doctor that.
And also to piggyback off that, so what is the benefit of choosing a board-certified surgeon?
Well, I think board certification is the minimum requirement that a plastic surgeon should have to go to. Like, not every board certified plastic surgeon is an expert in rhinoplasty, but that's the minimum. And that board certification really determines or tells the public what if that person is really a specialist in the specialty that he claims he is. For example, if you have a heart problem, you would go to a board-certified cardiologist. You wouldn't just go to any doctor. So the same thing, if you want plastic surgery, you would go to someone who's certified by the American Board of Plastic Surgery.
And when you want a rhinoplasty, you go to somebody who does 200.
Do we have time for one more question? I had one more. We get asked this a lot, but patients will bring in photos of any procedure that they like on someone else, or they'll refer back to a celebrity or something along those lines, saying they want their nose or their breasts or their whatever. And I was wondering if that gives you an idea of kind of what look they're going for, or if that even helps you at all, because when you're working with their anatomy, obviously you can't give me, Jennifer Aniston's, anything, unfortunately. But I was wondering if that helped you at all.
That does help me in the sense that I get an idea of what that person, the ideal,
what beauty is to them.
Okay. What they're looking at. However, if
their anatomy,
I can't do. It's
this is not happening.
It's a very rough estimate of what what they're going to end up with. So it gives. I like that. It gives me an idea, but I cannot guarantee it or replicate.
Because,
replicate those pictures.
You really are basing it on their natural anatomy, and I noticed that your rhinoplasties are also natural looking, and I think it's because you do stick to their natural anatomy and just refine it and soften it, or for women make it a little bit more feminine, but they still look like them.
Yeah, it's the same. In plastic surgery in general, you take the nose or breast, or and you improve on it. You can't give someone a totally different nose or face or eyelids. So you just improve it. So again, thank you everyone for joining us, and again, I'm looking forward to your comments, and we'll see you again next week, same time, same place.
Bye-bye.
Bye.